Hello students, my name is G. Nikita. I'm Pharmacy Assistant Professor in Department of Pharmaceutical Chemistry. So I will deal the Medicinal Chemistry 2 subject for B Pharmacy 3rd year's first semester. So today we are going to discuss about local anesthetic. It is the 5th unit. So in this we will discuss the introduction, means what is the anesthesia and what is the local anesthesia and what are the routes of administration of the local anesthetics classification and what are the drugs we are used in local anesthetics mechanism of action, a structural activity relationship, structure synthesis, adverse drug reactions and uses. So first, let's discuss about what is the anesthesia before discussing about what is local anesthetic. So anesthesia is the Greek word which means insensitivity or the lack of feeling. So means when we give the anesthesia, what will happen means the person may lack of feeling means if at what side we are giving at that side he can't able to feel any pain or some if we give the general anesthesia means complete unconsciousness he will go. This anesthesia is mainly used during the surgeries or painful skin abrasions and severe burns. So the agent which induce the state of anesthesia are called anesthetics. So there are two types of anesthesia, that is general anesthesia and local anesthesia. So anesthesia is nothing but the lack of feeling or the loss of consciousness when it is given to the patient mainly during the surgery times or during the treatment severe burns. So the local anesthetics or the chemical agents, it will reversibly block the conduction of the impulse in all neurons when it is applied locally in appropriate concentration. So they provide transient loss of sensory pain or touch in a restricted region of the body. So what is a local anesthetic means? It will give only to the particular body part, means at what site the surgery is going on, at that site only this anesthesia is given. So at that site only we will occur the lack of feeling, means the person cannot able to feel the touch or the pain at the particular site. But in case of the general anesthesia, what will happen means the person completely have a loss of the consciousness will be occurred. So this is the main difference between the local anesthetic and general anesthetic is nothing but the local anesthetic means it is given to only the particular body part. In that part only we won't feel any sensation. But in case of the general anesthesia, what will happen means the person completely he will went into the unconsciousness. So there are several ideal properties should be followed for the local anesthetic, that it should be potent and it should be non-irritant to the tissues, means at what side we are giving this injection, at that side it should not cause any damage to the tissue, and it should be non-toxic in nature, and it should not cause any permanent damages at particular site, and it should have the less systemic toxicity and rapid and long lasting in action, and it should act selectively and effectively when it is injected, and it should be sterile and the stable, means this injection has been stored now at that place. It should be sterile and stable, and it should not be interfere with the healing process, and also it should be produce reversible action, and the nerve membranes are made up of lipids, so there should be adequability and also lymphophilic to cross this membranes, and they should also be the water soluble. So these are the several ideal properties should have for the local anesthetic drugs. So let's see what is the general mechanism of action. So local anesthetic, it will exert the membrane stabilizing effect, that is the failure propagation of the impulse without affecting the resting potential. So it should block the entry of the sodium channels by inhibiting and initiating the propagation of the impulse across the nerves. So here what it will do means it will block the entry of the sodium channels into the cell. So sodium channels, it will contains the activation gate on the extracellular side and inactivation gate on the intracellular side. So at the resting state, the activation of the sodium channel is closed. See here in the resting state, here if you see the sodium channel gate has been closed, but in the activated state, it has been opened. See here in the activated state, it has been open. In the resting stage, it has been closed. So when the depolarization occurs, the activity gate opens and it allows the sodium ions to flow into the nerve. So during the repolarization, the inactivation gate will be closes and influx of the sodium ions will be occur. So the local anesthetics were the weak bases, so it undergoes the ionization at physiological pH. So these are the weak bases. And the unionized of the local anesthetics is all able to cross the lipophilic cell membrane. So they can also able to cross through the lipophilic cells. So once it will reaches the axoplasm, so it will bind to the local anesthetic reporter, which is located with the sodium channel in its intracellular half. So being the local anesthetic, the receptor decreases the permeability of the sodium ions to the sodium ion channels and thus prevent the generation and conduction of the muscle. Means the general mechanism of action is nothing but here it has to be inhibit the entry of the sodium channels into the cells. So sodium ions has to be inhibited. The entry of the sodium ions has to be inhibited because the sodium ions has the activity of the conduction of the muscle nerve impulse. So in order to avoid this process, so we have how to avoid the entry of the sodium channels into the cells. So this is the general mechanism of action. Let's see general properties. So it contain the aromatic molecules and tertiary amine groups. So which are linked either by the ester or the amide linkage. And the tertiary amide is the hydrophilic, while aromatic part of the anesthesia is lipophilic in nature. So local anesthetics are weak bases. So I have explained in the mechanism of action now, these are the weak bases and also they are usually available in the form of the salt. And also in vivo conditions, they exist in cationic forms. So these are the insoluble in water, unstable in amine forms, and but their salt form are usually stable. So when the drugs are available without the salt form means they cannot able to soluble in the water. So but when they are available in the salt form means they are be stable. And local anesthetic action is exert better at alkaline. So when it is in the alkaline pH, they can able to perform very well. And in vivo part of the drug in the ionized form, while the rest is unionized form, is essential for exerting local anesthetic action. So the unionized form is essential for the penetration into the nerve, so which undergoes the reionization to cationic form. And this cationic will binds to the receptors. So if the pH is acidic, the local anesthetic remains in ionized form, which prevents the active diffusion. And also the local anesthetics are effective in infected and inflamed tissues as they have the acidic pH. Let's see general pharmacokinetics. So absorption. So systemic absorption of the local anesthetic is affected by several factors like dosage, at what site we have taken the injection, and drug tissue binding, and local blood flow and other chemical properties of the drug. So surface anesthesia as well observed from the broken skin ends, and also the mucous membrane and poorly observed from the unbroken areas. And due to their lipophilic nature, they are very well absorbed and also very well distributed in the body. They easily penetrated into the skin, heart, kidneys, and the muscles. So systemic absorption means at what how much amount of dose we are taking, at what site we are giving this injection, and also the drug tissue binding, and also local blood flow is more important. If we are taking into the systemic means it may be the intravenous or intramuscular route. Systemic means sorry on the surface of the anesthesia means we are applying on the skin. So it will easily penetrate into the body where there is this broken skin. But if there is not broken skin means it cannot easily absorb into the body. So it is the lipophilic in nature, so it can easily distributed in our body, and also it will also reaches the brain, heart, kidneys, and the muscles. So metabolism means the amine type local anesthesia such as lignocaine under metabolism in the liver, where they converted into the water soluble metabolite and it is excreted in the urine. So basically this local anesthetics are they does not soluble in the water. They are lipophilic in nature. So when it undergoes the metabolism process, what will happen here? It will convert it into the water soluble metabolites and it is easily excreted in kidneys. So these are the general pharmacokinetics of the local anesthesia. So next, general adverse drug reaction. First one is CNS manifestation. CNS manifestation. So CNS means central nervous system. So in this case, what will happen if we take the drug at the low doses? What will we can feel the headache, drowsiness, and visual disturbances means cannot able to see properly. If we take the high dose means what will happen? Convulsions, coma, and respiratory problems. In case of the central nervous system effect in means here if we take the drug in the low dose means we will feel the headache, drowsiness, and visual disturbance. If we take the drug in the high dose means coma, convulsions, and respiratory failure will occur. CVS in means cardiovascular means heart. So the side effects will be occurred to the heart. So what are the side effects? Hypotension means low reducing of the blood pressure and arrhythmias. Next, allergic reactions. So allergic reactions, what will happen? Skin rashes, dermatitis, and asthma. So other effects include of the blockage of the neuromuscular transmission with high dose of local anesthetic. So these are the general adverse drug reactions what we can able to see in local anesthetic drugs. Let's see the method of administration of local anesthesia. So there are five types, that is topical or surface anesthesia, infiltration anesthesia, conductive block anesthesia, central nerve block anesthesia, intravenous regional anesthesia. So there are five types. See, topical or surface anesthesia, infiltration anesthesia, conduction block anesthesia, central nerve block anesthesia, and intravenous regional anesthesia. If you see the conduction block anesthesia is divided into two types, that is field block and nerve block. See, two types, field block and the nerve block. And if you see the central nerve block anesthesia is also two types, that is epidural block and spinal block anesthesia. So let's see what is the topical or the surface anesthesia. So this can be able to apply on the surface of the skin, such as mouth, nose, ears, trachea, and pharynx. So we can able to apply on the surface of the skin, such as mouth, nose, ear, pharynx, and trachea. So what are the drugs we can apply as the surface or the topical anesthesia? That is cocaine, tetracaine, lidocaine, and benzocaine. So we, like cocaine, tetracaine, lidocaine, and the benzocaine, we can able to apply it as a surface anesthesia, and it can able to affect the sensory nerve ending. So sensory nerve endings are affected when we apply the topical or the surface anesthesia. Next one is intrafiltration anesthesia. So it can able to applied or injected under the skin. Just this is the skin. So just under the skin only we can able to apply the infiltration anesthesia to block the nerve terminals. So what are the drugs we can able to apply as the infiltration anesthesia means lidocaine and mipavocaine. So these are the drugs we can able to apply as the infiltration anesthesia, that is lidocaine and mipavocaine. So it will affect the nerve terminals. So nerve terminals will be affected in case of the infiltration anesthesia. Next, conduction block anesthesia. So it will apply around the nerve trunk. So it can apply on the nerve trunk. Here two types, that is field block and the nerve block. So this field block is injected to the subcutaneous in the surrounding area of the scalp. So it is injected in the subcutaneous in the surrounding areas of the scalp. So what are the drugs? That is lidocaine and prelocaine. So lidocaine and the prelocaine can able to give. And what are the areas it will get affected means the all the nerves which present in the surrounding areas of the injected site. So at what site we are giving that at that site only the nerves will get affected. Next one is nerve block. So this type of the injection will be given to the close to the nerve trunk or around the location of the nerve trunk, means the area which is near to the nerve trunk at that site, or the area which is present surrounding around the nerve trunk. At that place we will give the this type of anesthesia, that is nerve block anesthesia. And what are the drugs? That is mipavocaine and lidocaine. And what are the parts it will affect means bronchial. So next one is central nerve block anesthesia. So in this, there are two types, that is epidural block and spinal block anesthesia. So this type of anesthesia is given to the spinal cord. And in this case, what were the drugs we will use means based upon the duration of the action. So how much time of the drug we want means that based upon that we will use the drugs. So in this case, what the spinal cord and spinal nerve root will be affected. Next, intravenous regional anesthesia. So it is directly given to the vein of the limb. So in this case, the nerve fibers will be affected. So I will explain it again. So in case of the topical or the surface anesthesia, it is directly given to the surface of the skin where the nose, mouth, pharynx, and ear, trachea. So it will affect the sensory nerve endings. And next, infiltration anesthesia. So the dilute solution of the local anesthetic is injected just under the skin to block the nerve terminals. So it will affect the nerve terminals. Next, conduction block anesthesia. And it is mainly given to the surrounding areas of the scalp. So in this first one is field block. So the field block is given around the surrounding areas of the scalp, and the nerve block it will given the place which is nearer to the nerve trunk or around the place located to the nerve trunk. Next, central nerve block anesthesia, it is mainly given to the spinal cord. Intravenous means it is given to the nerve, so it is given to the limbs, veins of the limbs. Intravenous regional anesthesia. So these are the methods of administration of the local anesthetic. So let's see the classification of the drug. So first one is based upon the source. So first one is based upon the source. In this first one is natural agent, example cocaine. Next, synthetic nitrogenous agents. In this, derivatives of para-amino benzoic acid. Derivatives of para-amino benzoic acid. In this first one is freely soluble. Example procaine, amitocaine, and poorly soluble is benzocaine and orthocaine. So next one is derivatives of benzoic acid. Example hexylcaine and methylcaine and piperocaine and cyclomethicane. Next one is derivatives of acetylnilide. Examples are prelocaine, lignocaine, and mepiracane. Derivatives of phenolene, cin- cincocaine, and dimethoxoquine. So synthetic nitrogenous agents, that is benzyl alcohol and propanediol, and miscellaneous drugs are clove oil, phenol, and chlorpromazine. See, I will explain it again. That is natural agents. The first one is natural agents. Example, cocaine. Next, synthetic nitrogenous agents. Second one is synthetic nitrogenous agents. In this first one is derivatives of para amino benzoic acid. See here, derivatives of para amino benzoic acid. In this first one is freely soluble. Example is procaine. Procaine, amitocaine. See here, procaine and amitocaine. And poorly soluble is benzocaine and orthocaine. Benzocaine and orthocaine. Derivatives of benzoic acid, that is hexylcaine and meprilcaine and piperocaine and cyclomethicane. Next, derivatives of acetanilide and prilocaine, lignocaine and mepiracane. Next, derivatives of quinoline, that is uh, cyclocaine, and synthetic nitrogenous agent, that is benzyl alcohol. Miscellaneous drugs are clove oil, phenol, and chlorpromazine. So these are the drugs which is based upon the source. So next one, based upon the mode of administration, means at what site we are, what route we are administrating this drug. Based upon the mode of administration, there are two types, that is injectable and surface anesthetic. First one is injectable anesthetic, next one is surface anesthetic. So in injectable anesthetic, first one is low potency and short duration. Example, procaine and chloroprocaine. Next, intermediate potency and duration is prilocaine and lidocaine. Next, high potency and long duration is bupivacaine, tetracaine, and ropivacaine and dibucaine. So these are the drugs which is based upon injectable anesthesia. That is low potency and short duration, that is procaine and chloroprocaine. Intermediate potency and duration is prilocaine and lidocaine. High potency and long duration is bupivacaine, tetracaine, and ripivacaine and dibucaine. Surface anesthesia, next one, that is soluble and insoluble. So insoluble, that is cocaine, lidocaine, and tetracaine. So insoluble is benzocaine, oxytazine, and butabaine. So these are the drugs based upon the mode of administration. Next, based upon the chemical nature. First one is benzoic acid derivatives. So this is the benzoic acid derivatives. And if you see, this is the structure of the benzoate. See a 6-member ring benzoate. So in R1, R2 position, in R1 and the R2 position, if you replace it with the different atoms, means we will get the different drugs. So first one is hexylcaine. In R1, the hydrogen is present. In R2, this is cyclohexane. And how many carbon atoms are there? 3. So 3 carbon atoms means propane. This is amine group is there. See, cyclohexane. 6-membered ring, cyclohexane. 1, 2, 3. 3 carbon atoms means propane. And amine group is present in the R2 position. Next, meprilcaine. Here in R1 position, hydrogen is there. And in R2 position, 1, 2, 3. 3 carbon atoms are there, means propane. In the second position, the methyl group is there for the propane. This is amino. 1, 2, 3. 3 carbon atoms means propyl. See here, 1, 2, 3 propyl. 1, 2, 3 propane, and here methyl amino group is attached. Next, piperocaine. In R1 position, hydrogen. In R2 position, this is the piperidine structure. See here, 6-membered ring with 1 nitrogen means piperidine, and here one of the methyl group is there, and 1, 2, 3 carbon atoms means propane. See here in R1 position hydrogen, R2 position piperidine with methyl and propane structure is attached. Next cyclomethane. Here in R1 position, what is their cyclomethane in R1 position? The six membered ring with one oxygen group is there. So hexyl oxy. See here side. This is in the form of cyclic form. So it is cyclohexyl oxy in R1 position, and in R2 position the piperidine with one methyl group, and here propane is attached. So next cocaine. Here one of the six membered ring, and here one of the eight membered ring is there. So eight membered ring is octane. So for this eight membered ring octane, here nitrogen and one of the methyl group is there, and here six membered ring is there here, that is phenyl, and here one of the carbon atom with two oxygen atoms are there. So this is the carboxylate, and here one of the carboxylate is present. See here octane. For the octane in the 8th position nitrogen and methyl group is there, in the 3rd position carboxylate, and here phenyl. In the 2nd position carboxylate is attached. The next one is para amino benzoic acid derivatives. So this is the benzoate structure. For the benzoate structure in R1, R2, R3, R4 and R5. See here R1, R2, R3, R4 and R5. So if we replace with the different atoms, we will get the different drugs. So first one is benzocaine. In R1, hydrogen, R2, R3, the hydrogen atoms are there. In R4, methyl group is attached. And in butamine, in R1, R2 and R3 position hydrogens are there. In R4 position three carbon atoms. So 3 and here 4. So the 4 carbon atoms means butyl is attached in the R4. Next procane, R1, R2 and R3 hydrogens are attached, and here R4 ethyl and R5 diethyl. See here 2 ethyls are there, 1, 2. So diethyl amino is attached. Next, tetracane in R1 position butyl, R2 and R3 position hydrogens, and in R4 position ethyl group is attached. In R5 position diethyl amino group is attached. Next, butacane in R1, R2 and R3 positions hydrogen groups are attached. In R4 position 1, 2, 3. 3 carbon atoms are there means propyl. And here how many carbon atoms are there? 4. So how many are there? 2. 1, 2. So it is dibutyl amino. Next, benoxynate in R1 position hydrogen, R2 position butyl, and in R3 position hydrogen atom is attached. In R4 position ethyl, and in R5 position diethyl amino is attached. Next, propoxycane, R1, R2 hydrogens, and in R3 position propoxy, R4 position ethyl, R5 position diethyl amino is attached. Next, anilide derivatives. So for the here R1, R2 position, if we replace it with the different atoms, means we will get different drugs. That is lidocaine in R1 position methyl group, in R2 position diethyl amino, ethyl is there. See here diethyl, this is amino and this is ethyl. In mepiracane, here amino methyl group is R1 position, in R2 position piperidine structure with methyl. See here 6 membered ring with one nitrogen, that is piperidine, and here methyl is there. Next, prelocane, here in R1 position hydrogen, and in the R2 position one of the carbon atom, here the methyl group is there, amino group, and here 2 carbon atoms, and here 1, so that is propane. Next, ethidocane, here in R1 position methyl group, And here in the R2 position, 1, 3, 2, 3. 3 carbon atoms means propane. And here amino, for amine group, here ethyl group is attached, and here for one of the carbon atom, here one of the ethyl group is attached. Next, miscellaneous drugs. That drugs are, so next miscellaneous drugs. So in this exam, first one is phenacane. If you see here, two phenyls are attached. See here, two phenyls, and here ethoxy. 1, 2. Two carbon atoms means ethyl, oxygen. So two diphenyl ethoxy is there, and this is the ethane diamide. See here, two amine groups are there. So it is ethane diamides. So diphenyl ethoxy, diphenyl ethoxy, and ethane diamino is there. Next, diperodone structure. See here, this is the structure of the piperidine. See here, piperidine structure is there. 1, 2, 3. 3 carbon atoms means butane, and here oxygen is there. So 3 carbon atoms means propane, and here one of the phenyl, here another phenyl is there, and this is the carboxylate, and here one of the carboxylate is attached. See here, piperidine, 1, 2, 3 carbon atoms means propane, and here phenyl, and here phenyl, and this is the carboxylate, carbonyl, and this is one of the carbonate structure is there. Next structure is dibutane. Here this is the structure of the dibutane. If you see here, 6-membered ring are there, two 6-membered ring with one nitrogen atom. And here in the second position, the butane structure is, butane is attached, and here in the fourth position, the carboxamide is attached. Here one of the amine group and dimethyl groups are attached. So this is the classification of the drugs.